I feel that it is our ethical duty as healthcare providers to be patient advocates. We are involved in advocacy on a daily basis when we see our patients. That's what we do when we educate our patients, when we counsel our patients. So sometimes it's important to kind of step back, take a look at what you're actually doing, and call it advocacy, because that's what it is. It's case advocacy. Preventing burnout is not just about going to a bunch of resiliency courses and doing some yoga and getting a hobby outside of medicine, but oftentimes it's about figuring out how to bring meaning back into your patient care, meaning back into the research that you're doing. And for me, one of those things is by participating in advocacy. For me and for many others, I think my best antidote to burnout is by participating in advocacy, because it's what really brings meaning to my work. It's what fulfills me, and it allows me to identify myself as a migraine warrior, which is what I'm doing on a daily basis on behalf of my patients. Sometimes people shy away from those opportunities. I think the only thing I would say is really throw yourself into every single one of those opportunities. And that's one way that I've been able to incorporate that, because number one, it's good for my professional growth. It's also good for my practice to continue my professional development, but also it's my way to be able to participate in advocacy where it kind of fits seamlessly into my career. And that also applies to media opportunities. I don't know, I was one of those individuals who didn't necessarily like to be involved in that because I felt like I would end up saying the wrong thing or get quoted a way that I didn't want to be quoted. But if you put in a little bit of preparation, you have a couple talking points. Now I've committed to myself that the way that I can participate in advocacy is anytime I have a media opportunity, I immediately respond. The nice thing is they actually don't take very long because people in media don't have a lot of time themselves. So usually interviews are like within a couple minutes. And so they don't take a long time. The little bit of advanced preparation of a couple little sound bites or talking points that you have, you're able to deliver that appropriately, whether it be in print or it be for a video. Grab all of those opportunities, because that is another way you can seamlessly incorporate advocacy into your clinical practice and your career. To participate in advocacy doesn't mean that you have to be the one who is out there going to Capitol Hill every year, the one out there going and talking to their congresswomen and men about different policy issues that could affect headache medicine, going to every single advocacy event and that you can potentially go to, because those things are time intensive and some people will want to do that. But what we can all do is empower our patients to become advocates. And that really is just the part of our education process that we have with our patients, providing them avenues to then become advocates themselves. And that's a way that a busy clinician, just through their patient education, can encourage a patient to go to the American Migraine Foundation website and join that advocacy movement. Encourage them to go to the different migraine advocacy events, going to Headache on the Hill. If we encourage our patients to do that, not only are we empowering our patients, reducing learned helplessness and loss of power, so we're helping them even from a medical perspective, but we're also participating in advocacy by involving other individuals. The other thing too is that we already participate in advocacy when we're asked to speak at different events with other healthcare providers, whether it be grand rounds at our institution, whether it be doing talks for different physician organizations, outreach to primary care providers or training programs, the medical education we do. All those things are also a part of advocacy, making sure that we bring appropriate access to care and appropriate treatment to our patients with migraine and other headache disorders.